Anti-seizure drugs, anti-epileptics, generations at a glance. Did you know that anti-seizure medications have evolved through multiple generations, from older, well-established drugs to highly targeted modern therapies? In today's video, we're breaking down the generations of anti-epileptic drugs in a simple and visual way so you can understand how epilepsy treatment has changed over time. Section 1. This infographic divides anti-seizure drugs into three major generations: first-generation drugs, second-generation drugs, third-generation drugs. Each generation reflects advances in effectiveness, safety, tolerability, and precision treatment. Section 2, first generation. Let's start with the first-generation anti-seizure drugs. These are the older classic medications that have been used for decades and remain very important in clinical practice. Some well-known examples include carbamazepine, diazepam, phenytoin, phenobarbital, valproic acid derivatives, lamotrigine, gabapentin. These medications are well-studied and have proven long-term effectiveness. For example, ethosuximide is especially known for treating absent seizures. Benzodiazepines like clonazepam and clobazam are commonly used for seizure control and emergency management. The major advantage of first-generation drugs is extensive clinical experience. However, many of them can have more drug interactions, greater sedation, and higher toxicity risks compared with newer agents. NASH Section 3. Next, we move into second-generation anti-seizure medications. These newer drugs were developed to improve safety, tolerability, and broader seizure coverage. Common examples include levetiracetam, oxcarbazepine, topiramate, pregabalin, rufinamide, zonisamide, tiagabine, vigabatrin. One of the most widely used drugs today is levetiracetam, also known by the brand name Keppra. Second-generation drugs often provide fewer drug interactions, better side effect profiles, and easier dosing. Many of these medications are now commonly used for focal seizures, generalized seizures, pediatric epilepsy, and status epilepticus. Finally, we arrive at the third-generation anti-seizure drugs, the newest advances in epilepsy management. These medications are designed to target more specific seizure mechanisms with improved efficacy and safety. Examples include cenobamate, ganaxolone, fenfluramine, lacosamide, eslicarbazepine acetate. Some of these newer agents are especially important for rare and difficult-to-treat epilepsy syndromes. For example, ganaxolone is approved for CDKL5 deficiency disorder. Fenfluramine is used for Dravet syndrome and Lennox-Gastaut syndrome. These newer therapies represent the movement toward precision medicine in epilepsy care. Section 5. Important clinical point. One important thing to remember is that classifications may vary depending on references. For example, lacosamide and eslicarbazepine may appear in different generations in some sources. This highlights how epilepsy pharmacology continues to evolve. The biggest takeaway from this infographic is that anti-seizure therapy is continuously advancing. Drug selection depends on seizure type, patient-specific factors, side effect profile, age, comorbidities, and individual response. There is no single best anti-seizure drug for everyone. As neuroscience and precision medicine continue to advance, the future of epilepsy treatment is becoming more targeted, personalized, and effective than ever before. If you found this breakdown helpful, don't forget to like, subscribe, and share this video with anyone interested in neurology, pharmacology, or epilepsy care. Thanks for watching, and I'll see you in the next video.